If you're over 70, listen carefully. There are subtle signs your body may be giving you, signs that something serious could be developing, even cancer. But the truth is, many of these warnings are so silent, so easy to overlook, that most seniors don't even realize them until it's too late. You've taken care of others your whole life, your family, your loved ones, your community. Now it's time to take care of yourself, because when it comes to cancer, early detection isn't just helpful, it can be life-saving. In this video, we'll break down 6 of the most commonly ignored signs of cancer in people over 70. These aren't the obvious ones. These are the quiet warnings, often brushed off as just aging, but you need to know the difference. So grab a cup of tea, sit back, and let's talk honestly, like family, about the health truths that could save your life or the life of someone you love. Sign number 1, unexplained weight loss. Have you, or someone you know, lost 10 pounds or more without even trying? No diet, no extra exercise, just weight quietly disappearing. It might sound like a blessing to some, but in seniors, it can be a dangerous red flag. Unexplained weight loss is one of the most commonly ignored early signs of cancer, especially in people over 70. When your body starts to shed weight without a change in eating habits or physical activity, it may mean that something is disrupting your metabolism, such as cancer of the stomach, pancreas, esophagus, or lungs. As we age, our bodies naturally change, but sudden or steady weight loss, more than 5% of your body weight in a few months, should not be chalked up to just getting older. Personally, I've seen older friends and family feel relieved to lose weight without effort, thinking it was lucky. But silent changes inside the body don't always bring lucky outcomes. It's always better to ask your doctor than to assume it's harmless. Now let's move on to another common but silent warning, a type of tiredness that no nap can fix. Sign number 2, chronic fatigue. Feeling tired is normal, right? But what if you're sleeping 8 hours and still waking up exhausted every day? What if simple tasks like walking to the mailbox leave you drained? That kind of fatigue isn't just age. It could be your body waving a red flag. Chronic fatigue that lingers for weeks, especially when it's not improved by rest, can be an early warning sign of several types of cancer. This includes leukemia, colon cancer, or lymphoma, where your body is silently battling internal changes that drain your energy reserves. Unlike normal tiredness, cancer-related fatigue tends to feel deeper, more persistent, and unrelenting, as if no amount of sleep can bring you back to normal. I once spoke with a retired neighbor who said, "I just don't feel like myself anymore." He brushed it off as aging. Months later, he found out he had early-stage colon cancer. The truth is, you know your body best. If something feels off, trust that instinct. Next, we're going to talk about one of the most overlooked signs of cancer, something visible but often dismissed, sores that won't heal, or unusual bleeding. Let's take a closer look. Sign number 3, sores that don't heal or bleed abnormally. We all get cuts or scrapes sometimes, but what if that sore on your skin or inside your mouth just won't go away? Or you notice blood in your urine, your stool, or even after coughing. These are not just signs of aging. They could be early alarms your body is screaming. Non-healing sores or unusual bleeding can indicate several forms of cancer. For example, a sore that lingers in the mouth might be an early sign of oral cancer. Blood in the stool could suggest colon or rectal cancer. And spotting blood during coughing or urination could be linked to lung, bladder, or kidney cancers. The key here is duration and recurrence. If a sore doesn't heal after 2 to 3 weeks, or if you experience unexpected bleeding more than once, it's time to see a doctor. I get it. It's easy to brush off these signs. It's just a hemorrhoid, or it's nothing. I bit my cheek. But after 70, your body speaks in whispers before it screams. Paying attention early could mean the difference between a quick treatment and a late-stage diagnosis. Coming up next, a sign that hides in plain sight, changes in your skin, moles or spots that might look harmless, but aren't. Sign number 4, unusual changes in bowel habits. Bathroom habits can say more about your health than you think. Are you suddenly constipated all the time, or making too many trips to the toilet, day and night? Changes like these might not just be about aging. They could be silent signals from within. Sudden or persistent changes in bowel or urinary habits, such as chronic constipation, diarrhea, difficulty urinating, or increased frequency, can be warning signs of serious issues. These changes may be early indicators of colon, bladder, or prostate cancer, especially when they occur without dietary or medication changes. Other signs include pain during urination, blood in the stool or urine, or the feeling that you haven't fully emptied your bladder or bowels. It's important not to normalize these issues as just getting older. Your elimination habits are directly connected to how your internal organs are functioning. Many older adults feel embarrassed to talk about bathroom problems, even with their doctor, but ignoring them out of discomfort is risky. I always say, if something changes in your routine, your body's asking for help. Don't ignore it. In the next part, we'll look at a warning sign that's often mistaken for stress or aging. Persistent pain that doesn't go away. Let's explore what it really means. Sign number 5, persistent cough, hoarseness. A little cough during flu season? That's normal. But what if that cough lingers for weeks? Or your voice sounds raspy without a cold? These could be more than just seasonal nuisances. They could be red flags. A chronic cough, lasting more than 3 weeks, especially when it's dry or causes chest discomfort, should not be ignored. Similarly, persistent hoarseness or changes in your voice may point to issues with the throat, lungs, or vocal cords. In older adults, these could be early signs of lung cancer, laryngeal cancer, or even thyroid issues. If HO is accompanied by blood, shortness of breath, or unexplained weight loss, it's time to see a specialist. I know many people over 70 tend to explain it away. I'm just getting old, or it's the dry weather. But here's the truth. Your body doesn't make noise without a reason. That lingering cough or raspy voice may be trying to tell you something serious. Next, let's talk about a warning sign you might see but dismiss as a normal part of aging. Unexplained pain that won't go away. Sign number 6, unusual lump or swelling. Have you ever felt a strange lump while getting dressed or bathing? It might not hurt, and you might think, it's nothing. But what if that small bump is your body's way of waving a red flag? The appearance of a lump or swelling anywhere on the body is one of the most common early signs of cancer, especially in the breast, neck, armpits, groin, or abdomen. While not all lumps are dangerous, a painless, firm, and persistent mass should always be checked. In men, lumps may indicate testicular cancer, while in women, breast lumps can signal breast cancer, even in older age. Don't ignore new swellings, particularly if they grow or don't go away within a few weeks. I've spoken with seniors who found something unusual, but delayed seeing a doctor for months, thinking it would just go away. But here's the truth. The earlier you act, the more control you have. A quick checkup can mean the difference between catching something early or not at all. Up next, we'll explore a sign that's easy to brush off, yet incredibly revealing: difficulty swallowing or persistent indigestion. Sign number 7, difficulty swallowing or persistent heartburn. You've eaten that same soup for years, but suddenly swallowing feels harder. Or maybe you're waking up at night with a burning chest and bitter taste. It might feel like acid reflux, but what if it's not? Persistent indigestion, acid reflux, or difficulty swallowing, dysphagia, can sometimes be more than just a digestive issue. In older adults, these symptoms may signal esophageal, throat, or stomach cancers, especially when they worsen over time. If you find yourself needing to chew longer, drink more water to get food down, or you feel chest discomfort after eating, don't ignore it. Accompanied by unintentional weight loss or vomiting, it becomes a serious red flag. Many seniors blame these symptoms on aging or their dentures. But I always say, if your body is struggling to process food, something it's done every day for decades, it's worth asking why. Listening to your gut literally could save your life. Let's quickly recap the 7 silent signs we covered today. 1. Unexplained weight loss. 2. Persistent fatigue. 3. Sores that won't heal or unusual bleeding. 4. Changes in bowel or bladder habits. 5. Chronic cough or hoarseness. 6. Lumps or unusual swelling. 7. Trouble swallowing or long-lasting indigestion. These signs may seem small on their own, but when your body whispers, it's your job to listen before it has to shout. As we age, it's easy to chalk everything up to just getting older. But there's a big difference between natural aging and silent suffering. I've seen people live longer, healthier lives just by catching one of these signs early and taking it seriously. So don't wait. Don't ignore it. Talk to your doctor. And remember, this isn't about fear, it's about power. The power to act, the power to prevent, and the power to protect your future. If you found this video helpful, give it a thumbs up and share it with someone you care about. It might just save a life. And don't forget to subscribe for weekly videos that help you stay strong, sharp, and in control after 70. Your health is your story. Let's keep writing it, one strong chapter at a time.